Okay. Well, good evening. Thanks for joining us. This is the first of our NYDA, New York Disability Advocates roundtables. We're going to be doing these around the state, and you get to be our test case tonight. So we do appreciate that you're joining us. We did want to quickly go around, introduce ourselves, and then have you let us know who's here, and we will then get into, as I mentioned, a brief, very brief overview of some of the issues and where the NYDA group has come together on, and then we'll get into what I hope will be a good discussion. So let me just start and go around, and I'm Mike Alvaro. You see from my sign, I'm with CP, but tonight we're NYDA, New York Disability Advocates. Bob?
Paul Castro, Angela's house and connections.
Tom?
I'm Gatto of Struff Associates.
Great. Lisa?
Lisa Birch, Epic Family of Human Service Agencies in Epic, Long Island.
Great. Cole? You're on mute, Cole, but we got...
Sorry about that. Cole Yastrzemski, Legislative Director to New York State Assemblyman Tommy John Scavone.
Great. Jamie?
Hi, Jamie Crispin from Family Residences and Essential Enterprises.
Perfect. Chris?
Hey, I'm Chris Gardner. I'm Judy Griffin, Assemblywoman Judy Griffin's Chief of Staff at the District Office.
Evan?
Evan Sullivan with Otroff Associates, representing NYDA.
Great. Stanford?
Stanford Perry with AHRC Nassau and Citizens Options Unlimited.
Great. Eileen?
I'm Eileen.
I'm sorry. Go ahead.
Oh, which Eileen?
We're going to do them right in a row since you're
Go
going.
ahead.
Why do we go? Eileen Egan first. Go ahead.
All right. Hi, I'm Eileen Egan. I'm the CEO of Community Mainstreaming Associates in Westbury.
And then Eileen.
I am Eileen Benthal. I'm legislative aide to Assemblywoman Jody Giglio.
Terrific. Thank you. Samantha.
Hi, I'm Samantha Jenkins. I'm legislative aide to New York State Senator Mario Matera.
Great. Tara.
Hi, I'm Tara Riddle. I'm with Senator Monica Martinez.
Great. And then Senator Martinez.
Thank you. Senate District 4, Suffolk County.
Great. Thank you for joining us. Senator Rhodes.
I am Steve Rhodes. I proudly represent the 5th Senate District, which is the southeast corner of Nassau County. Hicksville, Plainview, Old Bethpage, down to the Seaford-Massapequa line, and then as far west as the Meadowbrook, back up into East Meadow, a little bit of Westbury, Salisbury, and then cuts across.
Great. Thank you for coming. Abigail.
Hello, good evening. My name is Abigail Melendez, Executive Administrator for Assemblyman Noah Burrows.
Great. Elizabeth?
District 18.
18. Okay. Elizabeth.
Hi, I'm Elizabeth from Assemblyman Steve Stern's office.
Great. Jenny?
Jenny, Legislative Director to Senator Rhodes.
Oh, terrific. Emily?
Hi, everyone. Emily Murphy, Chief of Staff to New York State Assemblywoman Rebecca Cassay.
Great. Thomas?
Hi, I'm Thomas Makos. I'm representing Senate District 9 for the Office of Senator Kansas Area.
Great. And then Liam?
Hi, I'm with Senator Martinez.
Great. Thank you for joining. So we're NYDA, which is New York Disability Advocates, and that is a group of disability organizations that have come together to advocate and unify our message and really coalesce on our advocacy. We've done a lot of data collection over the years. We've tried to pride ourselves in keeping up to date on where the field is and where they're going. You'll see some of the data points in this presentation as well. But we really think that we've been able to be successful by partnering with you and having your support. And we've tried to make the message as realistic as possible, our asks are as realistic as possible, and to give you a sense of where the field is. So the first thing that we wanted to talk about is just in general the disability system in New York State. There's the voluntary providers, which is what NYDA represents, which provide 85% of the supports and services to people with disabilities in the state. And there we employ over 100,000 DSPs across the state, and we're in essentially every county in New York State. Stanford, do you want to cover this?
Thank you, Mike. And I also want to thank you all for being here as we discuss these very critical issues. Your partnership certainly has made the difference down through the years. As we look at our funding system, which you see on the screen, it's important to point out that services for people with developmental disabilities are primarily funded through Medicaid, with both state and federal government contributing to those dollars. But one thing that's important to understand is that the OPWDD budget sits outside of the state's Medicaid global cap. And that means that it doesn't automatically adjust as healthcare and other operational costs increase because there is a Medicaid global cap. So as you can imagine, this creates a situation where provider rates do not keep up with the costs of providing services. Even though rates are supposed to actually reflect costs that are delivered to provide services, that has not been the case in our field for a very, very long time. And because of budget neutrality, these rates have been held down for years, and they no longer come close to covering our real costs of operating these programs for some of the most vulnerable New Yorkers. Basically, the budget neutrality factor ensures that payment systems do not increase by more than a specified amount, often resulting in a neutral financial impact, which prevents a net rise in overall spending. As the chart on the screen indicates, back in 2006, New York State created an annual cost of living adjustment, which we now call a targeted inflationary increase. And that was designed to help agencies keep up with inflation and maintain a very stable workforce. They funded these cost of living adjustments for 3 years. After that, we went from 2009 to 2021, 12 years, with no adjustments at all. And during this time, our expenses kept rising and funding fell more than 56% behind the true cost of providing services. Because of this gap, we saw major problems with services seeing many providers seeing north of 35% or higher in terms of its turnover rate for its DSPs and its direct support workforce. Keeping up with quality and compliance for this very vulnerable population became very difficult and at times unbearable. Some of our group homes closed down. Waiting lists for services have continued to grow. So it's a major problem when the funding does not keep up with the services that are provided. I'll turn this over to Eileen, and she'll discuss the impact of the lack of investment over the years.
Yeah, I mean, Stanford already touched on a few of our issues. The number one that you keep hearing from us over and over again is the impact on our workforce. All of those years without cost of living increases, the minimum wage went up, you know, where we used to be 50% more than minimum wage pretty much caught up with what we were paying our staff. And the work that they do is not comparable to entry-level work. They're highly trained, they have a lot of stress and responsibilities, and they deserve a better wage. And also, as Stanford mentioned, we have had to close homes or not filled beds because we didn't have enough staff to cover the needs of the people who lived there. Similarly, in recent years, the last couple of years, we've gotten some injections of funding for staff wages, which is wonderful. It's definitely helped reduce the vacancies a little bit in recent months. However, we also have other costs of running our services, such as utilities and food costs and insurance costs that have all gone up. So it's really critical for us to be able to sustain the services that we provide, that we continue to fund the cost of living increases.
Right. Thank you. And I think that this chart here is really telling that the investments do work, and that's a message we want to make sure we carry to you, because we do appreciate it. It does work. Lisa, did you want to talk a little bit more about the investment and the impact on the workforce?
Sure. Thanks, Mike, and thanks again for everybody for joining us. We wouldn't be able to be successful in what we do without all of your support. And as I said, I am Lisa Birch. I'm the CEO of Epic Long Island, and I can tell you from personal experience the impact on the workforce. We employ over 400 what are called DSPs, direct support professionals, who are some of the lowest paid individuals in the field. And what we have found is that, it's impossible on Long Island for a DSP to have one job. And so most of the individuals that we hire and everyone else have multiple jobs. Some have 2 and 3 jobs. They're unable to, sustain their own households. And so we have individuals who are getting federal assistance themselves, right? We have individuals who are, some who live in shelters, some who are, homeless. And yet they still come to work and they do this work and they take care of the most vulnerable individuals. And it's tough when you're talking about individuals who have have to work 2 and 3 jobs, are raising their own family, and then have to come to a job where they have to take care of other people. And that certainly has an impact. We have been fortunate, as Eileen mentioned, and Sanford said, some of the influx of funding that we've received recently has allowed us to increase wages. And that's been helpful. We track, as most organizations do, we track our vacancies, our staff vacancies, and how many people are applying for jobs. And we noticed a significant spike just in applications when the post included a higher wage. So that's a start. Retaining those employees is the next challenge that we all have. But the vacancies are going down, the turnover is going down. We're just hopeful that we can continue with this trend as we move forward into next year.
Right. And again, I think that's a critical component to what we're suggesting, is that, as Eileen mentioned, the other expenses outside of the workforce, most of our spending is on personnel. We're 70% of our budgets about our people. But it's that other 30% as well that really does really confound us. And just like everyone else out there in the community, insurance, food, all of the utilities, all of those things are really increasing. The other point we wanted to make sure that we're clear on is, most of our providers are almost 100% Medicaid dependent. And with all the stuff that's going on in Washington, we wanted to make sure that we can find a way to ensure that the disability community isn't harmed. While there's no direct or explicit cut to the disability system coming out of Washington, obviously the state of New York has significant impacts. There are some SNAP impacts on our both our homes, but also our employees, and some of the eligibility checks are also going to be an issue for our employees. But we really need to work with you and figure a way to make sure that the cuts from Washington don't impact the disability community. And it really is one of those areas that right now, we just don't know where it's going to go. And as this unfolds, we really need partners in the legislature to help us make sure that there isn't an undue impact. Bob, do you want to talk about what our priorities are for this year?
Absolutely. And thanks everybody for, joining us tonight. One of the major pieces, in talking about the scale of keeping up with inflation over the years, is our first priority is the targeted inflationary increase. Trying to get that 2.7% and hopefully at that number, not, part of it and so on, because I think seeing some of the charts and what we've been showing really shows the impact of being able to offer better wages and support the agencies that are in the community. Um, we talked about DSPs and how even just with some of the rate increases that we've seen, how it's improved things, but we think there's still more creativity, for our care force. And I think, with the same respect of seeing salaries increase, we think that there are other ways that you might be able to, help us with these DSPs. And one of those is affordable housing, which, I think, as you heard, some of them being homeless, some of them, really almost surviving at our group homes, and the dedication is absolutely amazing. But if there's affordable housing, creating tax incentives for these staff and that are so important and critical to this system, mortgage incentives so that, they may be able to be on that home ownership path. And also the possibility of other tax credits, that, can help that care force. And all those, the last four, very targeted to the staff, and I think it's important that, with all the money we've seen, that you have the ability to know that, such a big emphasis to everything that's done is through DSPs and hands-on staff that, daily help everybody. So some of these creative ideas, I think, would be, really important to help, move us forward with such important staff care.
Thank you. And then, I think what Bob just talked about, as well as some of these ideas that we've been sharing with the administration that might be more administrative, really are nod to how important it is to be practical in what may not be the best fiscal situation coming into this year. The 2.7% is obviously an ask, and we definitely believe that we need that. But what we tried to do was look at some of those existing programs that are out there, and just by expanding them to include our workforce, our care force, we were hoping that that would be a very pragmatic way to go about this session here, and thinking about what might be doable as opposed to being sort of pie in the sky ask. So that's what you're seeing here, and some things like bringing back the healthcare enhancement program, and then streamlining some of the processes in OPWDD. So I know that was a lot, and let me just ask. I know Jamie, you were. I think I skipped you here, so I'm just wondering, anything that you'd like to add, or any points you'd like to make before we turn it over to questions.
No, I think that was great. Thank
Okay,
you.
so sorry,
Yeah.
Jamie.
No, it's all
I
good.
apologize for that. So that's my first screw up, and again, I can assure you I will do it again. So thank you all. Okay, so with that, let me just ask Evan. I wanted to make sure that we've covered everything we were supposed to. Is there anything else, Evan, that you think that we need to hit before
No,
we turn it
I
over to
think it's great,
questions?
Mike. I think definitely jump right into questions.
Okay, so why don't we stop and see if there are any comments from our legislative folks, senators, assembly members, anyone?
I actually do have a question.
Sure.
So, I actually have firsthand experience with lack of staff for those with disabilities. My younger sister has Down syndrome, and she's had a very hard time being able to find community rehabilitation staff and staff that worked directly, with the disabled. And I was just wondering if are these wages of private staff, let's say through organizations like Self-Direction, impacted by these investments as well?
Yes, they would be included in any of the increases. That's how they do it across the state. Yep.
Okay, great. Thank you.
So I guess our question for you is, what do you folks see as being sort of the driving policy issues this year, and how do we fit the disability messaging into that? How do we make sure that the supporting people with IDD remains a priority, given what you expect to see be the key issues this year for the session? Senator Rhodes, go ahead.
Sure, it's somewhat difficult to forecast at this point. Obviously, this all comes down to budgets, and budgets are about priorities. I think, I don't mean to speak for Senator Martinez or the various representatives that we have here. I mean, how we treat those who suffer from various disabilities is a reflection on what we value as society. So I think we all place their care at a premium. Obviously, we have to look at what the budgetary realities are. We'll have a better idea once we hear the governor's budget message at the end of January to find out where we're going to be in terms of where the anticipated cuts are, what our revenue forecast is. But I think we share near universal appreciation for what it is that you do, and certainly understand the priority of making sure our DSP community is taken care of, so that they can continue to provide for our most vulnerable.
Thank you.
And if I may, thank you, Senator Rhodes. Senator Martinez here. I agree. I think it's I don't want to say it's too early or too preemptive, but it kind of is, right? We know there's going to be an impact that's going to come down from the bottom, from the top down. We both have our conferences coming up, right, of what our legislative priorities are going to be. But I do foresee, and this time I won't speak on behalf of my colleagues, but I do foresee us having a conversation around healthcare, right? I think in having that conversation about healthcare, I believe this is the prime time for us to keep advocating for these providers and make them part of the conversation from the beginning, not at the end or in the middle, but I think they need to be at the beginning. And we need you, right? And we know we have you. We know you're there. You are one of the biggest advocates that I treasure and I love so much, because your passion, your heart, and the mission is there. But I think I'm going to speak on Senator Rose's behalf here, is that we do appreciate, like as he said, but I think you have the legislature. I think the issue is above us, right? We tried last year. We were successful in getting into at least the Senate one house, and then we saw it removed on the executive budget, right? So I think we need to push on the executive a little more.
And Senator, you mentioned, the focus on healthcare. Is connecting our services more closely, I guess people don't always think about the impact that our services have on the overall health system and those impacts. Is that a line of messaging that would make sense to emphasize the idea of the savings that we generate in other parts of the system by supporting, people in the disability community?
Look, I don't know how other people see it. I see you as being part of the healthcare system, right? I don't know how others view the community, but I think continue the education of that. Yes, you do have a huge impact on it, and you do have some cost savings as well. I think it's also very important. Yes.
Great, thank you. Stanford, you see your box is unlit. Are you ready to ask a question there?
Thanks, Mike. Yeah, my question is really a follow-up to comments that came from both the senators. Our State Budget Director, Blake Washington, recently said that we're in a good spot financially and on good fiscal footing. Since federal Medicaid cuts did not directly impact services to people with intellectual and developmental disabilities, what steps do you think we can take to ensure that New York doesn't look to the IDD sector to backfill other parts of the state Medicaid budget?
Look, that's a great question. And I mean, I don't think I would allow that, right? Senator Rhodes?
Yeah, I mean, it sort of dovetails to Senator Martinez's last answer. I think education is incredibly important here. In an area where we know that, for example, the controller is forecast in their 4-year budget that we're going to be looking at out-year deficits, which is something that we have to be conscious of, even if this year's forecast looks good. So demonstrating how it is when you're competing for limited resources, the value that you provide and the money that you save by properly investing in our DSPs becomes incredibly important. Demonstrating and selling yourselves and the service that's provided and the savings that are achieved becomes that much more valuable. So I would certainly focus on that, Stanford.
Thank you very much.
Sure.
That's great. Great
And
answer.
I apologize at this point, but this is where I kind of have to hop off. So I'm sorry to leave so early.
No, thank you for your time. Really appreciate you getting on.
Thanks so
Senator
much,
Rhodes.
Steve.
Appreciate you being on.
Oh, of course.
Let's turn
Good
it
to
over
see you.
to Eileen. I know has a question as well.
Okay, unmute. Okay. So I guess one of the things we want to talk about is the COLA and the inflationary increases have helped, but they're still falling short of inflation. So the one house budgets reflected our requests. How do we ensure that it gets approved by the executive? I mean, I know she's up for election this year. What do you recommend we do to better advocate for this?
I wish I had an answer for you. I really do. And I know Senator Rhodes is no longer here. I think I'm the only elected on here right now, but it's really having those conversations with the second floor and letting them know the importance of this. Again, it's the pushing, right? It's creating that, I don't want to say noise, but it is, right? And bringing those rallies and bringing the people up. And I know you have your day of advocacy, but it should not just be that one day that you're making that noise, right? I think the executive has to understand that this is a priority, and it's also a priority for the legislature. And to tell you, when I tell you that we push for this every single year, right? We understand it. The Assembly, the Senate, we get it, and we support it. It's, maybe at this time it's a conversation that I could also bring up in my conference and ask, how can we get this to get the executive to chime in? I mean, that's something like I could, this is just me talking, that I could present while I speak to my colleagues in the next coming weeks as we prepare for the next session. That we need to do something maybe a little extra on our end to keep pushing harder for you as well.
Thank you.
Just as a follow-up to that, Senator Martinez, what can we do? I mean, obviously, we know we have your support and others in the legislature, but how can we have the biggest impact to get our message across to the executive? I mean, we invite people to visit our programs. I think, sometimes that works. Are there other suggestions that you have or anybody else for how we can best message this?
What about campaigning, a campaign effort?
Okay.
Great idea.
Yep. And I guess this is for all the folks that are on from the legislative side. What do you remember? What is the most effective way to get this message across? Obviously, a lot of you have heard it before, and so there are things that are familiar. But what stands out as being those that really brought it home for you, so you were able to really understand what we're talking about? Emily, go ahead.
Sure, thank you. So I was thinking about this right when we started the Zoom. I'm so glad to see Bob here. We have the benefit of having Angela's house, one of the facilities in our district, and the Assemblywoman and I had the benefit of touring and meeting some of the folks that work there, meeting some of the residents there, and it was truly so impactful. And my other hat is as a social worker, and I think that storytelling is really powerful, especially with advocacy and seeing it and being in this space with folks who are doing the work, who we are supporting in this effort is really impactful. And that's just my 2 cents that really stuck with me. So I also just want to thank Bob for graciously having us visit.
Thank you, Emily.
Bob, do you have any follow-up question on that end or no?
You know, I do believe in that, and I know a lot of the agencies agree on that. I guess something that I feel that is very difficult is, we have, the executive staff in our region that we also try to speak to, but sometimes I don't know if that gets, to the governor. And so even though we can each in our areas can invite, these part of the executive team that, refers back to. So if you guys, do you feel like having them visit our homes or our programs or understand what self-direction is all about and how important each of these things are? You think that would help with the executive team to understand more and more, similar to the Assembly and Senate's visiting, programs?
Go ahead, Abigail. I'm sorry.
Yeah, no worries. I just want to make a comment on that, Bob. Yes, regionally in all different sectors. So I also come previously from Senator Webb's office, and I know that NYDA had an impact in her region. And they came full force in the last 2-3 sessions. As far as your advocacy days, it was consistent, almost as near as the medical aid and dying folks aligned in the advocacy efforts. But I do think having the executive regional offices, each office in each region, visit these facilities, that would definitely make an impact, because then as they're reporting back to the governor, she's constantly hearing this, NYDA. And so, yes, I do agree.
That's a great idea. Thank you. Really good.
Mike, I have one other thought too. Some of our staffing priorities, of the ones that I mentioned, 4 of them were directly about workforce. And I can understand sometimes when you're asking for a COLA or a target inflationary increase, that's an ongoing expense that you have to be concerned about. But in this coming year, do you feel whether it's affordable housing, tax incentives, mortgage incentives, child tax credits, whatever, if those were one time and agencies were able to work those in to support their direct, do you feel that would be an easier ask this year?
If anyone's speaking, you're muted. Or is there a deafening silence right now? Okay. I think what Bob's getting to is we put out a couple of things there. If there's one that strikes you as the most doable or the most likely to succeed, I guess that's what we're trying to get to. Is there something on the list you're looking at that you think would be an easier lift than some others? And that might help us focus a little. Right, Bob, that's what you're getting to is.
Yeah, and we've already explained through the statistical data that we have that DSPs, especially as we have registered our statistics, the money is going to them. And hopefully everybody understands, because I think the last 2 years, there was certain people out there saying it wasn't getting to that. The fact that this year we're overstating how much we still want to help our staff, in all different ways, because we also have increased insurance costs and so on, and trying to absorb some of that cost too. So I think it shows our commitment to wanting to help, our staff that are ultimately helping, those with IDD, within our community. And if there is a favorite of the different things we've mentioned that can have or be in, some additional incentive, to get and keep more of the DSPs here in our state and working in this field, which is one of the statistics. I think it was 85% really enjoy doing this kind of work.
So again, our prime ask is obviously the TII, the COLA, which does include, staff at 70 to 75% of our spending is typically spent on personnel. So that is important for so many reasons, as we talked about earlier: food, insurance, utility, all those expenses going up. We've got to maintain it. The chart we showed you at the beginning, where after so many years of no funding, the gap that's been created by not being kept up to the cost of living increase really does have an impact on our field. And one of the things that has happened over the long run is 20 years ago, our sector was able to pay enough above minimum wage that we were able to recognize it. The salaries recognize the differential in the type of work that's being done, and we're not there. We're getting back, and the investments are helping, but we're still not to the same place that we were before. So it's critically important that TII is in there, and then the other aspects of supporting staff, which we think are very practical ways to expand current programs or work on administrative pieces. That's the package we're really looking for, and we'd love your help on making sure we get this done this year. So I'm going to see if Evan wants to add anything in terms of what the follow-up's going to be. Obviously, I think you've gotten the materials that we presented here today, and others, but Evan, do you have any closing thoughts here? You're muted.
No, I appreciate everybody taking the time. We'll definitely follow up with the slide presentation and our materials. If there's any questions, feel free to reach out. One thing, we will probably be reaching out about is requesting, your support and sending a letter to the governor. We have been having a number of conversations with OPWDD, with with the governor's office, with division budget over the last several months, and we are getting some positive feedback and support. And I think one thing just to note too, the target inflationary increase, the new version of the COLA, it does cover a number of different fields, right? So it's OMH, OASIS, OPWDD, OCFS, and all in, it's for this year, the 2.7% ask is $280 million. So it leverages a significant number of dollars on the federal side, which has obviously a very large impact. And our biggest, I think, takeaway is the investments are working. We've had a total increase of 15.8%, but wages have gone up close to 26%. And then we're also looking at having legislation introduced to create that affordable housing lottery preference for the CareForce workers, which goes beyond just OPWDD employees. It will include folks on the LPNs, RNs that would be eligible, behavioral health staff, special education staff, right? So really kind of encompassing a lot of different components there, and there's no cost to that. So we should have legislation introduced shortly that's being filed that we'll definitely be asking for your co-sponsorship on. And we really appreciating the continued support that we've had from you all over the years, and keep pushing through.
So thank you all. Thank you, panelists, and thank you all for joining tonight. We really appreciate it. And as Evan mentioned, reach out to him, any of us. We'd be happy to answer any questions you've got. Thank you very much for your time.
Thank you, guys.
Good night,
Thank
everybody.
you.
Good
Thank
night.
you.
Everyone.
Yes.
Yeah.
Thank you.